Hi, I'm Shane Henderson, a massage and movement therapist, and today I want to talk about the pelvis, which is a beautiful structure within our body that I don't think gets enough love and attention. I specifically focus on pre and postpartum pelvic health, but this information is valid for anyone who has a pelvis. So I'd like to start by just looking at, as many people may have never seen, what's underneath the skin, right? So this is a replication of what our pelvis looks like. So we have these beautiful kind of wing-shaped structures here that when I stand up, I'll do it now. So this is when you put your hands on your hips. This is where your hands tend to follow you, right there on the crest of the ilium here. And then your pointer finger usually lands right about this bony process right here, which is called I'm just going to call it the ASIS for ease of terminology. So ASIS is here. So when we look at, and this is how it's positioned in our body. So this is how my pelvis is positioned in my body right here, okay? So if I have my hand on my hip, it's essentially on the pelvis, where my finger kind of falls, that point right in there, the SIS. Another important marker, so whenever I do a workshop with a patient and I'm looking at how to improve their pelvic health because they have some sort of issues with urinary incontinence, prolapse, pain, anything in this region, I always like to start with alignment because it's the starting point of everything to help things move more functionally throughout the body. So this becomes an important marker when we're lining up and trying to find neutral, as does the pubic symphysis. So that's the bony portion down at the lowest part of your torso. So those three, because we have two ASISs, right, one on each side, and the pubic symphysis, I reference a lot. When we're looking at the pelvis as well, it's so important for many things. We birth through the pelvis. It houses our pelvic organs, so our bladder, our rectum, our uterus, and our lower colon. We obviously evacuate through the pelvis. It connects the lower body. So through here is where the leg bones attach, and our upper body with the spine, okay, which is, you can see here in a bigger model that incorporates, so the leg bones and then the spine in comparison, okay? So it's many important, it's houses the center of gravity, it helps with movement, there's many important aspects of the pelvis. But today I want to specifically look at how alignment can help you with bladder issues. So this is going to be simplistic. Obviously, if you have a complex bladder issue, this is a step in helping. It's not necessarily the full answer to what you're looking for. But I find when there is an issue with any sort of urinary incontinence, stress incontinence, like things like jumping, sneezing, sneeze pee, cough pee, all that kind of stuff, alignment can really help with supporting and changing some of that symptomology. So if we look at the bladder, it's this beautifully shaped little guy, and I'm going to put it in its place within the pelvic bowl, okay? So if we are in great neutral alignment, and I'm going to go through what that looks like in your body, and I'm only going to do it in seated for this video's purpose, because it's really one of the big game changers because we do spend so much time seated. So in a seated posture, you want to, the other two important bones are the ischial tuberosities down here. Okay, so these guys, which will be referenced as the sits bones, okay? And I'll also talk about the sacrum at the back, which is the extension of the lumbar spine. The sacrum connects through these two hip ilium bones, okay? So when we're in good alignment, we actually sit on these bones called the sits bones. Isn't that a brilliant name? So in that position, all of the force is kind of absorbed through the bony structures in our body. And if we look within the pelvic bowl, the bladder has a beautiful little rest here on the interior side of the pubic symphysis. So it's got like a little bit of a support, okay? So if we're sitting in this posture and our bladder isn't malpositioned due to birth, surgery, anything like that, then this is a way for our bladder to be supported and not have as much stress when we're doing things like jumping, running, coughing, sneezing, okay? If we were in a poorly aligned position, so a tucked pelvis, which I'll show you again seated, what happens is now the bladder is a little bit more free-flowed, and when we look at gravity coming down, it's actually going down into the pelvic floor muscles, okay? So in that position, it's unsupported and you're requiring, it's more load on the pelvic floor muscles. So if there's any dysfunction within the muscles of the pelvic floor, this extra load can obviously not be helpful. So that's where alignment comes into being one of the key things in starting with pelvic health. How we align our pelvis is also important with breathing as well as core activation. So I always, when working with someone for a first time, I always look at the ABCs. So it's alignment, breathing, and then core activation, proper core activation. So we're just looking at alignment and seating in this video. So here is what the pelvis would look like. Now I'm going to go to a chair and we're going to go through that. I'm going to take that out a little bit more so you can see how it might affect your daily position. So when we sit down, a lot of us do the sit and slide, right? So right now in that position, I'm actually sitting more on the sacrum and the little tailbone in my body, okay? So all the pressure is in through here. And when there's pressure over time on anything in our body's like, oh, this is how you wish to align us. So you'll actually get, there is movement between the sacrum and the hip bones. So you'll actually get like a shortening of the interior space between where this bone is to the pubic symphysis. So instead of having, say, this much room, you're going to have this much room. That's an exaggeration, but you need to be able to see a difference. So there's going to be a decrease. So the muscles involved and attached, most of the muscles attached to the coccyx, the tailbone. So those muscles will then be in a shortened position. So now the pelvic floor muscles will not be able to fully lengthen in order to get a powerful contraction. So if we look at how that translates to another body part, imagine that, so if your bicep, you have full range of motion, imagine now that your arm is only here. So you can only generate force within this particular range, but to get an optimal function of the bicep, you really want that full range of motion so that you're activating all of the musculature and everything's moving well within the arm, as well as the rest of the shoulder complex and down through the body. So when we're doing like the sit and slide, and this is very common, you'll be sitting at your desk at work and you'll be seated like this, and you might be there for hours, right? On and off throughout the day, depending on how long you're there. So what you want to do is try and look at sitting more on these sits bones, okay? So what I do when I sit down is I take my bum to the back of the seat, and now already I'm in this position, and there's less, now this seat's very slippery, but in normal office chairs that are fabric, it doesn't allow you to really go into this position, right? So this is something that can be incorporated to any of your seated activities. It might feel strange in your body if you're really used to doing the sit and slide. And there's compensations that you want to look out for. Like, you don't want to correct the sit and slide by thrusting through the upper body. You really want to try and get into the seat correctly and then sit on those sits bones and allow your body to rest on this. So right now in the proper position, I'm sitting on these bones like this instead of the sit and slide where then the pressure would be. Here, I'll use, instead of my hand, I'll use a block. So when sitting correctly, you want to have the pressure on these guys right here. When we do kind of the sit and slide, what happens is we're back in through here. And that causes a whole bunch of compensations up through the body, which I don't really want to get into because it adds more complexity. But, you know, if we're leaning back like this, then we're kind of going into like a more fetal position. So our shoulders are falling forward. And that has implications to how functional your core can be, because again, it's going back to, if I'm always sitting like this, then those muscles in my core, my abdominal musculature, is always in a shortened position too. So they are not allowed to function optimally because they don't have that full range of motion that you want when you're doing any sort of strengthening exercises. So yeah, that is, I think, all I wanted to say about sitting in neutral. So again, neutral, you have these two bones in the front, the ASIS and the PSIS. So ideally you want those to line up. So they're like perpendicular to the ground if you were to draw a line. And then that puts you on your sits bones. So if I'm leaning back and sitting in the sit and slouch, then what happens is these bones are no longer at a perpendicular to the ground position, and you're applying more pressure through the sacrum, and you're really on like muscles, tendons, ligaments that you're not meant to rest on. So you're creating shortened changes within the musculature of the pelvic floor. Okay, so if you have any questions, please feel free to send them, or any concerns or any follow-up. And I will be going through different, standing postures, as well as lying when you're doing exercises in additional videos. So have a great day.